November 4th, 2008, this was released. It's the Drug and Device Accountability Act of 2008. And I thought that this would be rather interesting for you all to see. It's a bill now before the Senate that would require senior officers or directors of drug and medical device companies to certify under penalty of perjury that all information submitted for a product's approval is accurate and in compliance with federal regulations. Look at that fine and look at that jail sentence. Okay? If you think that what we do on a daily basis isn't important, that ought to tell you something right there. I'll tell you what. If I was a manager or a director in a pharmaceutical company right now, that would scare the living daylights out of me. And it would make sure that I did everything right. Okay? I just wanted to share that with you. How do we assure that we're compliant or complying with current good manufacturing practices? Well, we comply by following the risk-based approach to CGMPs that was published in August of 2002. We design quality into our process on the front end. We don't wait in our industry for something to happen, although that sometimes does happen, before we fix a problem. We're required by the FDA to build quality into our product on the front end. Now, I told you this morning that I was going to talk mostly about viable contaminants today, but I wanted to just make sure everybody in the room understood the difference between viable and non-viable contaminants. Viable contaminants are those that are living, and non-viable does not. We sample, when we have a particle counter in a clean room and we're sampling particles, we're sampling both. But the viable contaminants are what I want to talk about today, because my business was in making injectable drugs, and injectable drugs have a potential of greater harm than something that's made that's an oral medication. Now, obviously, we don't want contamination at all when we're manufacturing products, but injectable drugs have a greater potential because of the route of exposure. It's faster into the body. And I also wanted you to know a little bit about process analytical technology, considered to be a system for designing, analyzing, and controlling manufacturing through timely measurements while we're processing of critical quality and performance attributes of raw and in-process materials, processed with the goal of ensuring final product quality. It's all about quality. Well, how do we know we have a quality product that's free of contaminants? Well, we test those products after we've manufactured them to make sure. We take a certain representative sample and we'll put it through tests to make sure that there are no contaminants. But we don't want to even have to worry about that on the front end, and we do something that is a process simulation called media fills. So I'm going to talk briefly about media fills. Now, I have a lot of information on these slides that I could go over and take until 4 o'clock. But then the other speakers would probably be ready to shoot me, and you would too. So I'm not going to do that. But everybody will have these slides and the notes that go with these slides available to them at your asking. Just if you're interested in it, I have everything you need to know about media fills in the notes in these slides. Not all on the slides, but in the notes. So what about risk? All particles, but especially viable contaminants that may grow, I want to talk about today. That's our area of concern. Media fills are an aseptic processing operation that validates the process using a microbial growth control medium as the simulated drug product. Typically, who's doing media fills in their process now? So everybody's familiar with media fills. What are some of the media that you use? Tryptase, soy broth. Anyone doing anything for anaerobes? Fluid thioglycolate? What else is being used? Anything? I'm sorry? SDA, okay. So we do this, we use this media in place of where we would have our drug. And if there's any part of the process or any of the equipment or any of our procedures that we use that could potentially cause contamination in the manufacture of the product, we hope that we'll be able to identify where those are, mitigate those issues, and fix it so that we don't have that problem in the future. This includes exposing the media to the containers that we put it in, all the piping or tubing that we use when we're doing our filling, any surface that the product comes into contact with is part of our media fill. And any manipulations we put it through. A media fill program should incorporate the risks that we normally see on a production line and should assess the state of our control. Media fills is all about assessing our process control and should simulate aseptic manufacturing operations that we do on a daily basis. Sealed containers will be incubated to detect microbial contamination. And I've heard some people say, well, we don't do it this way, but this is what the FDA recommends. 22.5 degrees, plus or minus 2.5 degrees for 7 days. You take those vials, move them to a 32.5 degree C incubator, plus or minus 2.5 degrees for 7 more days. Obviously, you're going to inspect them after 7 days at 22.5 degrees. By the way, these vials are inverted. Does everybody know to invert their vials? That way we're assured that the media comes into contact with the stopper on the vial. And if there's any contamination in the stoppering process, the closure, then we can assess that too. Okay. This is the stuff I'm not going to go over in a lot of detail, but you will have all this as part of the slides when you get it. But we have a study design. The FDA recommends that your media fill address each of these issues. Shift changes, addresses things like lyophilization if your product is freeze-dried, aseptic filling, line speed, number of operators that you have in the clean room at the time of the fill. All these issues must be incorporated into your media fill study design. The frequency and the number of runs must be assessed, okay? Repeated enough times to ensure that you have some statistical significance, okay? Most of the time, how many times do you do it? 3 on initial qualification of your run line. You will run 3 media fills, okay? And how often do you do it after that? At least once a year. Some people do it, some companies do it twice a year. And then, do you have to do it any other times? When you make a change in your process or if there's a contamination issue. Okay? The duration of the run must be assessed. How long does it take you to run your fill? Okay? If it's a 6-hour filling run, are you going to run it for 5.5 hours? Normally, if it takes 6 hours, are you going to run a media fill for 5.5 hours? No. You're going to make sure that you run your media fill at least and probably a little bit longer than what your normal duration of your filling run would be. And the reason for that is if you're filling a drug product and something comes up and it takes a little bit longer, you want to make sure that your media fill validates the fact that it's okay to run that filling a little bit longer. The size of your run. If you're filling a 10,000 vial batch, you might want to fill an 11,000 vial batch. You kill 2 birds with 1 stone there. Probably going to increase the duration, and it's also going to give you a larger sample selection in the size of your run. The line speed. Sometimes it might be slower, sometimes it might be faster. In a media fill, you want to make sure that you vary your line speed from time to time so that you can validate the fact that if on a drug run, your media fill will validate the fact that a drug run could run a little bit faster or a little bit slower. And I know you, from the number of hands I've seen here, this is probably just a review for you. Environmental conditions, the representative conditions under which actual manufacturing operations are made should be met on the media fill. Okay? You don't want to have something at 75 degrees Fahrenheit if you normally run it at 70. Okay? The type of media that you use should be appropriate for the type of bacteria that you're encountering in your facility. Fluid thioglycolate is oftentimes used for anaerobic bacteria. Incubation and examine of the media filled units. They have to be incubated at the temperatures I said for a total of 14 days at the 2 different temperatures. And your vials need to be inverted. They need to be examined after a period of 7 days. What kind of examination do y'all do on your media fields after 7 days? Count. You do counts if you have growth. But what if you don't have any growth? Do you inspect 100% of your vials? And what do? You look at your vials. If they're turbid, you've got growth. If they're not, so it's just a visual inspection, right? Does anyone do anything besides a visual inspection? That's all you need. That's all you need. If you got growth, what do you do if you find one vial in 10,000 that has growth? Another media fill. Yeah. Now, do you, while you're doing your media fills, log what's happening on the filling line for each of those vials so that you can go back and say, oh, I might have 3 vials that are positive. What was going on when those 3 vials came up positive? Okay. That's what you're supposed to do. Okay. When I was doing media fills, when I worked in industry, that was probably one of the hardest things to do, was to record everything that was going on during the filling run so that I could go back and track it to a certain group of vials that I was working with. Fortunately, I didn't have very many positives, so that was good. Incubation and examine, I've got some more information here about that. I won't go through all that. Interpreting the results I just talked about. It's a visual interpretation. If you end up after 14 days with a positive, what do? You investigate, you rerun. Do you identify what it was that contaminated the vial? Absolutely. Because the source of contamination, or the microorganism that contaminates the vial, could help you determine the source, which could help you determine what in the process caused your problem to begin with. And then you can make that correction. Okay. Now, I told you I'd go fast. There are probably 10 pages of notes that go with these slides. So anyone who wants those, I'm going to leave my cards up here on the table. For anyone who wants one of my business cards, please feel free to give me a call. I can also email you anything that you want, and I'd be happy to help you with anything that I can do. Now, before I finish, I have one thing I would like to do. If you have people you want to get trained in media fills, you are in the right building, because we offer, through the BioNetwork and the North Carolina Community College system, classes here at the BTech. Elements of aseptic processing 1 and 2. And guess what you get to do in 2? Manual and automated media fills. So if you've never done a media fill, or you want to perfect your technique or learn a little bit more about it, this is the place to come. Please see Jane. She would be more than happy to tell you some more about it. Make sure you pick up one of the sheets out in the dining area that we had out here today in the front lobby that has the list of the classes that are offered here at the BTech. It's Elements of Aseptic Processing, or Aseptic Manufacturing 1 and 2. And 2 is the one that does the media fills. And you get to gown up and go in a clean room just like you were at work. Any questions? Yes, sir.
Are spores considered viable or non-viable?
Viable. Yeah. And not uncommon either. Not uncommon. Any other questions? Okay. Thank you very much.